sound. Okay, sorry, go.
Okay, I'm Hannah. I'll be your student nurse. I'm going to protect privacy. I'm going to come in here.
Yeah.
And perform hand hygiene. You tell me your name, date of birth, and allergies. Check your wristband. I grabbed my gloves already, so now I'm going to provide privacy or that's going to check the provider orders. And we are hooking up to suction and doing a dressing change. So I gathered all my supplies. I have everything I need. So first I'm going to get my tape ready to go so I can connect everything up. And then I'm going to put my gloves on and assist the provider with hooking everything up to suction. Into the chamber, I mean. So let's see where we're at here. Okay, so we are clamped. And I'm going to take this off and connect it here. This came out of my patient. I think it's supposed to go in there. And then I'm gonna hook up sections. Now I can unclamp. Okay, so now that I've done that, I'm gonna take off my gloves and I will wash my hands, but I don't have a sink by me. So, oops, I didn't ever tape this, so I would do that. Okay, so now I'm gonna go ahead and start getting my sterile field set up. So I'm gonna open everything with my 1-inch border. Open my forceps, and now I'm gonna grab my woven gauze and drop it. Open my split sponge, drop it, and try my best with this petroleum gauze that was already used. That's how it's gonna be. And now I'm going to put on my sterile gloves. Not turning my back to my sterile field. I'm gonna put my gloves on. Okay, so I would have gotten my phone tape ready for me, but my doctor's gonna do that. So now that I've done that, I'm gonna go ahead and get started here so I can use both my hands and get this ready the best I can. I folded it in the hot dog, so now I'm going to sacrifice a hand without touching my patient. And putting that there, and now I can use my forceps. Oops. Can I just put this around my patient without touching my patient? Keeping it sterile. And now I'm going to use a split sponge. And place that right where it goes. And then my second sponge. Just on the side there. And then my woven gauze right on top. So now I can touch all that. And I'm going to secure this with an airtight seal with my tape. And then once I have that all done, I'm going to date time and initial that. And now I can start to clean up my supplies and put my patient back in a comfortable position. So I'm going to assess the site for drainage and see if I need to change the dressing, which I don't. And then also going to check for subcutaneous emphysema, which is air trapped under the tissue. You would hear some crackling with that. I'm also going to check my tubing for any kinks, clots, dependent loops, which everything looks good. And then I'm also going to check my drainage system. I'm going to check in here for the type and amount of drainage. And I'm also going to assess that in vitals every 15 minutes for the first 2 hours, and then as ordered. And then I'm going to assess my water seal chamber and make sure that there's tidling, which is the water going up and down as the patient breathes. And then I'm going to assess my suction chamber and make sure there's bubbling and the suction is on. I think that was everything. Okay, so then that's it.